Good morning. I'm Ajay, Kakkar, Chair of King's Health Partners, and it's my very great pleasure to welcome you all to our annual conference, Transforming Human Health. And it really is a very great pleasure to have you at this hybrid event. We're building, of course, on the success of previous conferences, but on this occasion we come together at a time of great opportunity and great challenge. A time when the kind of academic health system that we aspire to build around KHP can come to the fore and can start to deliver the transformational impact that we all require and we desire. And today we have the opportunity to explore in a fascinating programme the opportunities that KHP has been able to muster through your hard work, commitment and dedication, all with a simple focus to serve the patients for whom we have the privilege to care, to ensure that we can improve outcomes, that we can drive forward the broader life sciences agenda, improving not only opportunities with regard to healthcare, but more broadly in our local community. And beyond that, to ensure that there is substantial population health gain through rapid adoption of innovation and technology. But that rapid adoption attends not only the adoption of innovative therapies and technical solutions, but also innovation in the way that we practice, innovation in the way that we use the estate available for us to deliver healthcare, innovation in the way that we train and develop future generations of healthcare professionals. And these are the kinds of issues that we're trying to consider in KHP, ensuring that we're able to address challenges in real time whilst also being able to address the future and ensure that our health economy is the most vibrant and successful in our capital, and beyond that, what we're able to establish, to determine and to learn is spread widely through our partnerships locally, through the capital, through the region, nationally and globally. Now, how are we to achieve these important objectives? How are we to continue to work together effectively? How are we able to ensure a proper focus on our local population whilst continuing to aspire to our global ambitions are some of the challenges that we face. When we look at the health system in our country more generally, we of course see the consequences of the COVID pandemic, the relentless focus now on addressing the ever-increasing waiting list, dealing with the severe challenges that our hospital and primary and community care systems face. These of course must be recognised. But we should also recognise in the KHP family the remarkable contributions that have been made during the COVID pandemic by our colleagues. Fundamental, translational, clinical research making a tremendous contribution. But the rapid translation of those findings into improving clinical practice, ensuring that resources could be appropriately applied and that clinical outcomes could be improved for those suffering from COVID, a disease that we knew nothing about at the beginning of the pandemic. Lessons from those learnings and the way that KHP was able to contribute are importantly recognised but must be consolidated as we move forward now to understand the opportunities for the future. We also have within our health economy the very exciting development of an innovation district, SC1, with all the opportunity that that provides. In terms of the driving principles, the values of our organisation, be it KHP, be it SC1, the values are those of true partnership working. We're privileged to be able to bring together in the partnership King's College London with Guy's and St Thomas's Trust, King's College Hospital Trust and the South London and Maudsley Trust. Remarkable organisations, each individually at the cutting edge of the delivery of healthcare and science and innovation. But working collectively together over the past 10 years, they've shown that they can deliver so much more. We now want to look at and see how we might take what have been achieved, the remarkable foundations, to the next level. Not only ensuring that the partners continue to work effectively together, but to ensure that what we've been able to do as 4 founding partners is now more rapidly translated into the local population through the adoption of innovations established by our own colleagues through the application of their intellect and insights for the benefit of those who live around us, who attend our institutions, and who regrettably experience some of the poorest outcomes in terms of health and experience of disparities in the determinants of health that are experienced anywhere in our country. The Innovation District would also provide the opportunity for us to focus on real estate development and the capacity to welcome new partners to the table from commercial and industrial backgrounds with the capacity to make substantial investments and bring their know-how, expertise and talent to our community and to our health economy. All of this, of course, must be undertaken and delivered within the national context. And KHP remains absolutely determined to make its contributions as a good and contributing citizen across London and more broadly across our country. We are deeply committed to and recognise the importance of the national agenda as set by government and the NHS. But we're also clear that the types of innovations that we're able to bring to the table are innovations that could have a transformational effect not only in our own communities, but across the country. The structure of KHP has therefore been modified to ensure that we can continue to make these contributions, and during the day you will see the product of that relentless focus on partnership and population through some of the remarkable work that's taking place across the partner organisations, led by remarkable colleagues, but also thoughts about innovation more broadly in the way that we educate and train, and the way that we're able to therefore ensure that future generations are able to participate in some of the most satisfying work available in our country, to serve as a healthcare professional, to be able to look after one's fellow citizens, and to ensure that the benefits of good health, not only in terms of the individual, but for communities and more broadly for the economy, can be experienced by all. This is a big agenda, and it's only possible, as I keep on saying, because of the commitment for partnership working. And the structures that have been established in KHP over the past 10 years have demonstrated themselves to be successful in ensuring that that partnership working across independent organisations and institutions has been successfully developed. I look forward to a very exciting day where we're going to be sharing innovation, where we have the opportunity for interaction and discussion. And once again, I'd like to thank you all for giving your time, agreeing to participate in what has become an important part of the calendar for all of those in the South London health community. A day like today, our annual conference is only a success because of your contributions, your willingness to interact, and your commitment to the organisation. And for that, I'd like to thank you all on behalf of the KHP board. And I'm now going to hand over to Professor Richard Trembath, our Executive Director.